Hello everyone, my name is Navdeep and I'm a registered nurse practicing in Australia currently from last 7 years. I'm making this video just to give you some idea to some of my fellow colleagues and some new students who are interested into a nursing career in Australia. Um, the main motive of this video is to show you that hospital is not the only nursing environment. There are different areas, different setups where you can practice as a nurse. So I'll just have a quick overview today, and I will obviously respect your comments or if you would like to add something to my today's presentation. So let's start. So we have different scenarios here. We can practice our nursing in hospital, in practice nursing itself. Practice nursing means that working with a general practice clinic. So it's like working with a GP, working with a family doctor. So here you have various responsibilities that I'll explain you in my further slides. Acute care nursing means when you work in the hospital in the acute sector. Aged care nursing, that's in the aged care sector. Community nursing, as it's in the community, in the homes. Nursing educator, focused on more academics. Then correctional nursing. This is a little bit different. Maybe not many countries may be having it. Correctional nursing means when you work within prisons or jails or basically looking after the prisoners. So what does a practice nurse do? A practice nurse has various responsibilities working alongside a GP. Some of them are listed here, but they are not limited to these. These can be many more. For example, collecting of blood samples. Usually they have pathologies on site, but sometimes practice nurses might have to collect some blood samples as well. Planning the care activities, which means care plans, and then tying up with the required allied health services included in the care plan. For example, in a client with diabetes, you would tie up with a podiatrist, a dietitian, diabetes educator as well. Then doing health assessments. Health assessments can be a lot. For example, health assessments for people over 40 years or 40 to 49 years, because we in Australia are very proactive about cardiovascular health. So we screen all 40 to 49 years individuals for cardiovascular risk screening, which is just a part of 40 to 49 years old assessment. Then we have assessments for people over 70 years. Then immunizations. Australia has a very robust immunization system. So here you include not only the childhood vaccinations, but you include adults, pregnant females as well. Minor surgical procedures are also done at general practices. For example, excision of a skin lesion, and then it can be sent for a biopsy. Iron infusions, a lot of the clinics do iron infusions now. You don't need to go to the hospital for just an iron infusion nowadays. Next is acute care nursing. So acute care nursing is when you work in the acute sector, in the hospital sector. It could be any area of the hospital. It could be wards, emergency, theaters, intensive care. You could do permanent shifts directly employed under a hospital, or you could go to the recruitment agencies first, the nursing agencies, and they can shoot you some casual shifts here and there. And usually starting with the agency nursing, it's a good pay rate because you are casual, and it also gives you exposure to different setups, different hospitals, and then you can choose and pick from the ones you like, or you can be offered a permanent opportunity at one of the hospitals. Next is the aged care nurse working in a residential aged care. It's not a hospital, it's aged care. It's a residential setting for people who are aged and who need support 24/7. For example, clients with dementia. They have very high care needs. They can't be kept at hospital because hospital is mainly meant for the acute sector, acute needs of the people. So they are transferred into our residential aged care system after an assessment by the government body called My Aged Care. So nurses have a lot of role to play in the aged care as well, and aged care sector is incomplete without nurses. Community setting. Community setting is totally different. You are not in hospital, you are not in aged care, you are not in a general practice, you are not within a four-wall boundary. You are traveling all day, you are traveling from client to client, client to client in their homes. So what happens is in Australia, the government tries to keep and support people at their home as long as they can, as long as they don't need a very high level of care. So we try to keep them in the homes with the minimum support that we can give. For example, someone needs daily visits for their insulin administration because they can't administer their insulin themselves for certain reasons. They can be like a cognitive decline, they can be arthritis. Simply, they can't just hold their insulin pen. They can have Parkinson's, which means their dexterity has been altered. So things like that. Someone with a permanent indwelling catheter, someone with a suprapubic catheter. So for management of catheters, they can't go to the doctor's clinic every day. They can't go to hospital every day. So here, community nursing comes into play, basically helping them at home so they don't need to go anywhere out. And not everybody is fortunate enough to go out themselves. So here there are different programs like homeless persons programs called HPP. For people under 65 years of age, there is called PYP for young persons. And then for people over 65, it's called CHSP, that is Commonwealth Home Support Program. And then there are various home care packages. So basically, these terms means the type of funding they are getting to be at home. So who gives the funding? It's the Australian government. So where there are different providers in Australia which are called community care providers, community health providers, and the nurses are employed under them. So that's community nursing. And I am practicing as a community nurse from last 2.5 years, and I bet you it's a wonderful job. Correctional nursing. I don't have an experience in correctional nursing, but what I know about correctional nursing is it's working in a correctional care or a judicial sort of setup, like prisons, jails, remand centers, juvenile detention centers, criminal justice system is involved in this. So basically, you're looking after the prisoners. So we are not leaving someone who is in a detention center just like that, just because they have done a crime. No, everybody has a right to good health. So that's where you do correctional nursing. Means nursing within a jail or a prison like that. If anybody is a correctional nurse, please do comment below. I would like to know more about this as well. Nursing educator. So like back in India, from where I come from, we used to call it clinical tutor or clinical instructor or nursing tutor. It's like when you go into the starting from the scratch to the upper level, like you become the professor, the associate professor. So you have to have postgraduate qualifications or certain extra certificate courses. Like in Australia, the basic course to start into the academic nursing is that other than having your nursing qualification and registration with APRA, you have to hold a certificate 4 in training, assessment, and education called Cert 4 TAE. So you can get into the vocational education sector from where you can teach enrolled nurses. You can get into the unis, but you need to have higher qualifications for that. You can be professors, associate professors at uni level, or simply you can be just budding or preceptoring your young nurses, or new nurses, or a new team member. So mainly focused on teaching nursing skills and academics. In the end, I would like to thank you for listening to my presentation, and I would also like to thank you for adding comments below. And please let me know what else you would like to know more in my future videos, because I'm really keen on making my channels as informative as possible. So I will thank you once more. See you next time.